A live look right now at the U.S. Capitol, where we're expecting the House to vote this week on a massive bill for President Donald Trump's agenda. Now, it calls for more spending on defense and immigration enforcement. But as 11 Alive's Joe Ripley reports, health care could see some cuts, and it could hit Georgia families pretty hard.
As Congress works to hash out a spending bill, Whitney Griggs with Georgians for a Healthy Future says health care access could be at risk.
People just can't go to the doctor because it's too expensive, or they can go to a community clinic, but if they get sent to something else, they don't have health insurance to pay for that.
Lawmakers are considering slashing spending on Medicaid. Griggs says that could prove disastrous just a year after more than 1 million Georgians had to confirm their Medicaid eligibility through the process known as unwinding.
We did see a shrink in the number of Georgians enrolled in Medicaid. A lot of folks, especially kids, kind of get kicked off their Medicaid and then have to go through the process of re-enrolling in Medicaid.
Yeah, I don't think they'll be impacted in a way that people will see or feel.
Georgia GOP Chair Josh McCoon says Congress should keep a more watchful eye over how it doles out funding.
I don't think you're going to see any reduction in actual service to Medicaid recipients. I think there's going to be a laser focus on getting rid of duplication, waste, fraud, and abuse while keeping that service intact.
But Griggs says cuts to Medicaid could result in mounting confusion, losses in coverage, and even hospital closures due to financial strain. Georgia's Pathways program, which implements a work requirement, could be replicated at the federal level, but Griggs says that comes with more risk.
You close the door on someone enough times, they're going to just not come back again.
Joe Ripley, 11 Alive News.
Griggs says that cutting health care funding would hurt rural communities the most because they have a hard time trying to get the care because they're so far out. So the House is expected to vote on that bill before Memorial Day.